Hello? Hello? Okay.
Drop ಆಯ್ತಾ ಕಾಲ್?
Hello?
Drop ಆಯ್ತು ಕಾಲ್.
Okay, call has been cut. Okay, and one more doubt I have, that is, see, when person is in depression or something, they do go to doctors also, and they prescribe medicines. If it is not possibly incorrected in that way, you people do counseling for them also?
It's more than that. See, for things like some medical conditions, like if somebody has hallucination, ಯಾವ ಥರ ಒಂದು ಏನೋ ಸೌಂಡ್ ಬರುತ್ತೆ, ಇಲ್ಲ ಯಾರೋ ಒಂದು ಗೋಸ್ಟ್ ಕಾಣಿಸ್ತಾರೆ, ಆ ಥರನ ಅದು ಸೈಕಾಟಿಕ್ ಪ್ರಾಬ್ಲಮ್, ಅದು ಮೆಡಿಕಲ್ ಓನ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್. ಕೌನ್ಸಿಲಿಂಗ್ ಕೆನಾಟ್ ಹೆಲ್ಪ್ ದೇರ್. ಬಟ್ ಇನ್ ಥಿಂಗ್ಸ್ ಲೈಕ್ ಡಿಪ್ರೆಷನ್ and some other kind of problems, medicine can help them feel better. But counseling can help them understand why they are depressed, what is happening, and change their thought pattern. ವಿಚಾರಣೆಗಳು ಸ್ವಲ್ಪ ಬದಲಾವಕ್ಕೆ counseling help.
Okay, so we have a call again. Hello? Hello?
Hello?
Hello, who's speaking?
Hi, my name is Archana and I had a question for Mr. Janta, please.
Yeah, sure. Archana, ನಿಮ್ಮ TV volume na please reduce ಮಾಡಿ.
Sorry?
Can you reduce your TV volume?
I can't hear you, sorry.
Can you please reduce your TV volume?
My TV is not on.
Okay, fine. You can talk to Mr. Janta.
Hi Archana, tell me.
Yeah, hi, Mr. Janta. My name is Archana and I had a question for you and I'm sure you relate to it. How do you manage being a working woman and taking care of a house and all the stress that's related with it? Because, for example, I can't sleep at night, you're trying to be perfect about everything. How do you really cope with all of that?
I think that's a question, Archana, which a lot of women, sort of ask themselves. I think it's got to do with the expectations that you have from yourself. You know, the pressures that one puts on oneself, saying that I must be a perfect wife, or how I define a perfect wife, I must be a perfect working woman, a perfect mother. And the truth is that, it's not really possible to be perfect every day and all the time. So I think it depends on the sort of, expectations that you have from yourself. I think just getting a little realistic and saying that, okay, so there are some things I can do, prioritizing your, work, and there are certain days when you'll possibly, your role as a mother will be more than what your role as a working woman is. I think, and also taking time out for yourself. What do you really want in all the roles that you're fulfilling? Are you somewhere, sort of your sense of joy, your sense of dreams, what do you really want? So keeping track of that as well. I think doing all of this, and I would say the main thing, Archana, would be to just sort of taking stock of your own expectations about yourself.
And I think,
No, that's very helpful. Thank you so much.
Okay. Thank you, Archana. Thank you for calling in.
ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ಕಾಲಿಂಗ್ ಅರ್ಚನಾ. ಸೊ ನಮ್ಮ ಮುಂದಿನ ಪ್ರಶ್ನೆಗಳನ್ನು ಖಂಡಿತವಾಗ್ಲೂ ಕಂಟಿನ್ಯೂ ಮಾಡೋಣ ಒಂದು ಸಣ್ಣ ವಿರಾಮದ ನಂತರ. ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಎಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ಮಿಸ್ಟರ್ ಮಹೇಶನ್ ಜಂತಾ, ವುಡ್ ಯು ಟೇಕ್ ಕೌನ್ಸಿಲಿಂಗ್ ಇನ್ ಎಜುಕೇಶನಲ್ ಆರ್ career based or something?
See, in certain small parts, like we are not like CET counseling. We don't tell what college to go to or what job to go to. That is not the kind of counseling.
Exact one.
There are specific tests for those also.
Yeah.
Okay.
So there are career counselors who will do aptitude tests, interest tests, etc. But the kind of counseling that we do as trained and certified counselors is to help people through the stress of that, to be able to get clear on what they would like to do. And in certain some situations you have one son who's being forced, saying, okay, you have to study engineering.
Exactly.
That son might be saying, no, I want to do music, I don't want to do all of that. So he might be protesting a lot of that, might be doing very badly in college, etc. So in those kind of situations, if they come, we can help them know, listen, your son is really not interested in engineering, don't force it like that.
Exactly. Some people do, no? The parents and all, they feel, no, according to me, my decision only, the kid should
that
study or
becomes like
something.
a family counseling situation where we do that more kind of family kind of thing. But we don't do like, it's not a counseling is very misused term in many things. We have people who are doing recruitment call themselves career counselors.
That's what people don't understand. Counseling means they just understand, like they do give for everything. All solutions are there.
One stop shop.
Exactly. Yeah, they do think that.
Yes.
Okay.
So that one I will talk 1 minute about that. What is certification and training.
Okay.
Why, you know, in inner sight, how is it different from anybody in a recruitment firm or anything?
Okay.
So as counselors, what Ajanta and I trained in is that we have a background in psychology and psychotherapy, but more than that, what we do is a very skill based training. Saying
Okay.
so because, you know, talking to people who are in difficult times is not easy. So people may be very upset or very frustrated or angry. So to be able to help them, saying come to be okay, and saying that okay, let's talk about what you're going through, how you're. It is a very skill based program. So in that, to train in that, we Ajanta and I and all our other counselors too. We have counselors who work in C.V. Raman Nagar, Fraser Town, Sarjapur, Rajaji Nagar and Jayanagar. So all of us who are there, we all trained from Parivartan, which is Bangalore's one of the best counseling training centers. And we trained in basic skills. Then we also trained to work with families. And so if you have ever try to talk to two people who are fighting, husband and wife, you know how difficult it can be.
Exactly, sir.
So, or if you try to talk to like a 6-year-old boy, you know how difficult to try and understand. So it needs specific kind of skills is required.
Exactly, yeah.
So Ajanta and I and our other counselors, we all trained to work in these kind of ways. So that is the main thing which differentiates what is a certified trained counseling agency like ours from anybody else, or that is the main difference.
So people ಯಾರಿಗಾದ್ರೂ ಏನಾದರೂ ಪ್ರಶ್ನೆ ಇದ್ರೆ ಖಂಡಿತವಾಗ್ಲೂ ನಮಗೆ ಕಾಲ್ ಮಾಡಿ ನೀವು ವಿಚಾರಿಸಬಹುದು. ಅವ್ರು ಹೇಳ್ದಂಗೆ ಸೈಕಾಲಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್, ಇವಾಗ ಅಕಸ್ಮಾತ್ ಮಕ್ಕಳ ಜೊತೆ ಡೀಲ್ ಮಾಡಬೇಕಂದ್ರೂ ಟು ಡೀಲ್ ವಿತ್ ಕಿಡ್ಸ್ ಇಸ್ ರಿಯಲಿ ಅ ಬಿಗ್ ಪ್ರಾಬ್ಲಮ್. ಆ್ಯಂಡ್ ಅಗೇನ್ ಲೈಕ್ ಮೆರಿಷಿಯಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆರ್ ಸಮಥಿಂಗ್, ಮದುವೆ ಆದಮೇಲೆ ಡಿವೋರ್ಸ್ ಆಗಲಿ ಅಥವಾ ಮಿಸ್ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ಸ್, ಎನಿಥಿಂಗ್ ಕುಡ್ ಬಿ, ಫಾರ್ ದೋಸ್ ಥಿಂಗ್ಸ್, ಎನಿಥಿಂಗ್ counselors are really here. You people can really contact us and talk to us. And one more question, Ajanta, and is this counseling like lifelong you need to take, or some particular sessions are there for that?
I think that's also a certain sometimes a worry that people have.
Yeah, that do worry.
That if I go in for one time for a counseling session, do I have to go continue going?
Yeah.
I think like Mahesh was explaining, the first session is really an assessment session. So in that session we kind of get some idea about how many sessions we would require with a client, and we discuss it with the person. And at the end of that many numbers, we actually discuss and check how they're feeling, or how whether the problem that they came with, if they're feeling a little bit more relieved, or they've got a different approach to work with it. So it's not lifelong, it's very solution focused. So you come in with an issue, we set out with a goal, and then we work through it. Sometimes what happens is when you're working on something else comes up. So let's say they've come in with a work related issue, that I'm feeling demotivated at work. I can't go into work. Every day I drag myself to work and I don't like it. And while we are working with seeing where the stress is from, why he or she is feeling demotivated, what may actually come up is that there is a lot of stress at home.
Yeah, and another problem arises, in between.
So that is impacting what is happening here. So it's but yes, it's solution focused. It's not endless. There is a certain number of sessions at the end of which we do a closure session. And closure meaning this issue is done. After 2-3 years, if something else comes up, or at any other point, they can come back.
They can come
Usually
back,
3 to 20. 3 to 20 sessions is what is normal. Sometimes it's only one session, because somebody just wants to come and talk to somebody. Because in our modern world, so much of stress is there, and nobody really wants to take the time to listen.
Exactly. Everybody wants to be finished, and like earlier it should be finished. Also, only one session, 2 session, they ask why should we come again and again. They keep asking.
So they usually we ask at least to have openness for 3 to 8 sessions. Sometimes it goes up to 20, but 3 to 8 is average, and not more than that. One of the main objectives of counseling is to help that person live their life. Okay, independently, without any kind of counseling.
Yes, so the idea is through the process to empower the person. To make the person feel that they can do it by themselves.
Atmavishwasa barabeku ante.
Not a crutch for lifelong. So therefore that certain stressful period we are there, and then they are